Joint pain after 50, causes, warning signs, and what you can do to stay pain-free. Welcome to Nutigood HealthBook, your trusted companion for better health after 50. Today, we're diving into a condition that affects many older adults: joint pain and stiffness. Why does joint pain become more common with age? And how can we adjust our diet, exercise, and lifestyle to keep our joints healthy every day? Let's find out why joint pain increases after age 50. After turning 50, our bodies go through natural aging. This affects not just our skin or hair, but also the structure and function of our joints and bones. Internal organs like the liver, kidneys, and cardiovascular system begin to decline, and so does joint function. Many people start noticing more frequent joint pain, cracking noises while moving, or morning stiffness. But what exactly causes this increase in joint pain as we age? Let's explore the most common reasons. 1. Osteoarthritis. The most common cause. This happens when the cartilage, the cushion between bones, gradually wears down. When this protective layer becomes thin or disappears, the bones rub directly against each other, causing pain, inflammation, and limited mobility. Osteoarthritis often affects weight-bearing joints like the knees, hips, lower back, and neck. Symptoms include joint pain and stiffness, especially in the morning or after resting. It can take a few minutes of movement to warm up the joints. 2. Osteoporosis. The silent threat. Osteoporosis is the gradual loss of bone density, making bones porous, weak, and easy to fracture. After age 50, calcium absorption decreases while bone loss continues at a fast pace. In postmenopausal women, declining estrogen levels accelerate this process, raising the risk of hip and spinal fractures. The danger is that osteoporosis often has no symptoms until a fracture occurs or persistent back pain appears for no clear reason. 3. Chronic arthritis. When the immune system attacks. Some individuals over 50 may develop chronic inflammatory conditions like rheumatoid arthritis, gout, or ankylosing spondylitis. Rheumatoid arthritis occurs when the immune system mistakenly attacks the joint lining, causing swelling and deformation if untreated. Gout results from high uric acid levels, forming urate crystals in joints, often the big toe, knee, or ankle, leading to intense, sudden pain, redness, and swelling. 4. Nutrient deficiencies. Missing joint building blocks. After 50, nutritional needs increase while absorption decreases. If your diet lacks essential nutrients, calcium deficiency weakens bones. Vitamin D deficiency hinders calcium absorption. Low collagen, a key part of joint cartilage, leads to faster degeneration. This is common in people who skip meals, follow restrictive diets, or don't get enough sunlight. 5. Inactivity. The silent enemy of joint health. A sedentary lifestyle reduces blood flow to the joints and limits joint fluid production, which lubricates and protects the joints. As a result, joints become dry, stiff, and painful, especially in the morning or after long periods of sitting. Inactive individuals are also more likely to gain weight, adding extra pressure to the knees, hips, and spine. Joint pain after 50 is not something you just have to live with. It often results from a combination of wear and tear, poor nutrition, immune issues, and lack of movement. The good news is, it can be managed once you understand the causes and take the right steps early. Signs to watch for and when to see a doctor. After 50, not every ache should be brushed off as just aging. Our bodies send warning signs when something isn't right, and ignoring those signs can lead to serious problems. Here are the key symptoms that your joints may be damaged and need professional attention. 1. Morning stiffness or pain during weather changes. This is an early sign of osteoarthritis or chronic arthritis. The pain is usually most noticeable in the morning after waking up, when joint fluid is low and the joints aren't warmed up yet. Many people also feel joint aches during cold, damp weather or sudden temperature shifts. That's because joint linings react to changes in air pressure and temperature. 2. Stiffness or difficulty moving after sitting too long. If it takes effort to stand up after sitting for a while, or you have to stretch and warm up your joints before you can move, your joints may be inflamed or lacking lubrication. This affects everyday life: walking, getting dressed, even basic movements. 3. Swelling, warmth, and redness around joints. These are signs of acute inflammation, common in conditions like gout, rheumatoid arthritis, or joint infections. If swelling is accompanied by heat and redness, do not ignore it. An untreated gout flare can lead to permanent joint damage. 4. Persistent or worsening pain. If pain doesn't go away after a few days of rest or lasts more than 2 weeks, it's no longer just simple fatigue. Especially if the pain worsens over time, spreads to other joints, or occurs even when resting, it's time to see a specialist to rule out arthritis or severe bone loss. When to see a doctor immediately? If you have joint pain plus any of the following: low-grade fever or chills could indicate a joint infection. Unexplained weight loss might signal chronic inflammation or autoimmune disease. Trouble sleeping due to nighttime joint pain, a sign of chronic arthritis. Joint deformity or misalignment could mean advanced joint damage. Especially if you have chronic conditions like diabetes, high blood pressure, or kidney disease, or you've been using anti-inflammatories or steroids long-term, get joint screenings at least twice a year. Don't wait until you can't walk or sleep well because of joint pain. Your joints, like your heart or memory, need proactive care every single day. Nutrition to support joint health. After age 50, your daily food choices aren't just about filling your stomach, they're about nourishing your body from within. Especially for your joints, the right diet can reduce inflammation, slow degeneration, and ease chronic pain. 1. Fatty fish, omega-3s, that fight inflammation. Salmon, mackerel, and sardines are rich in omega-3 fatty acids, which are natural anti-inflammatories that protect cartilage from damage and aging. Studies show that people who eat fatty fish 2-3 times a week have lower inflammation markers and significantly less joint pain, especially those with rheumatoid arthritis. Plus, fish provides vitamin D and easily absorbed protein to support muscles and bones. 2. Soy, tofu, and plant-based milk. Calcium and natural hormones. Soy is packed with calcium, magnesium, and isoflavones, plant compounds that mimic estrogen and help protect bone mass, especially in postmenopausal women. Almond, walnut, and soy milk provide cholesterol-free calcium and are gentle on digestion, great for older adults. Tip: drink 1-2 cups of fortified plant milk daily and substitute tofu for red meat a few times a week to support bone and joint strength. 3. Dark leafy greens, vitamin K and minerals. Spinach, kale, broccoli, and amaranth are rich in vitamin K1, which helps deposit calcium into bones and strengthens the skeletal system. They also contain magnesium, potassium, and antioxidants that neutralize inflammation, causing free radicals and slow joint aging. Aim for at least 2-3 servings of dark greens daily, split across your main meals. 4. Nuts and seeds. Nourish joints from within. Walnuts, almonds, chia seeds, and flax seeds are loaded with vitamin E to reduce inflammation. Plant-based omega-3s, to protect cell membranes. Antioxidants to slow cartilage degeneration. Just 1–2 tablespoons daily added to yogurt, oatmeal, or salads can act like a natural supplement for your joints. 5. Turmeric and ginger. Natural, safe, anti-inflammatories. Turmeric contains curcumin, a powerful compound proven to reduce joint pain on par with some medications without harming your stomach. Ginger improves blood flow to the joints, reduces swelling, and increases flexibility. Try adding turmeric to warm water each morning, or make ginger tea with honey in the afternoon to relax and ease inflammation. Foods to limit if you have joint pain. While adding joint-friendly foods is important, avoiding inflammatory foods is just as critical, especially after 50. 1. Refined sugar, candies, and soda. These spike inflammation throughout the body and contribute to weight gain, putting added pressure on your knees and spine. 2. Alcohol and beer. These interfere with calcium absorption and strain the liver, indirectly weakening bone health. 3. Red meat and fried foods. These raise uric acid levels, increasing the risk of gout and joint inflammation. If you suffer from frequent joint pain, start with the simplest step. Control what you eat. Healthy joints start with a healthy plate. Remember, food isn't a replacement for medication, but it builds the foundation for strong, pain-free joints in the long run. Lifestyle habits to keep your joints strong. You've probably heard the phrase, "Nutrition is the foundation, but movement is medicine." When it comes to joint health, that's absolutely true. Alongside a healthy diet, daily habits will determine whether your joints stay flexible or deteriorate quickly. Here are 5 essential habits everyone over 50 should practice. 1. Stay active. Keep your joints moving. Exercise isn't just for heart health or weight control. It stimulates the production of synovial fluid, the natural lubricant that keeps joints smooth and mobile. Low-impact exercises are best. Gentle walks 20 to 30 minutes per day. Senior-friendly yoga improves flexibility and calms the mind. Light cycling or swimming great for weak knees or spinal arthritis. Always warm up beforehand and stop if you feel abnormal joint pain. The goal is consistency, not intensity. 2. Prioritize sleep. Joints need rest too. Deep sleep is when your body repairs cells, muscles, and bones. If you're sleep-deprived or go to bed too late, growth hormone secretion drops and joint recovery suffers. Adults over 50 should sleep before 11 p.m. Aim for 7–8 hours per night. Avoid caffeine, late meals, and screen time before bed to improve sleep quality. 3. Keep joints warm in cold weather. Joints are sensitive to temperature and humidity. In colder weather, blood vessels constrict and joint fluid decreases, making joints feel stiffer and more painful. Here's what you can do. Wear layers, scarves, and gloves when outside. Use heating pads or warm blankets at night. Avoid heavy lifting or sudden movements in cold environments. 4. Use hot or cold packs correctly. One of the easiest ways to relieve joint pain at home is alternating hot and cold therapy, but use them the right way. Heat therapy, warm towel or heating pad. Use when joints feel stiff, it boosts circulation and eases tension. Cold therapy, ice wrapped in a towel. Use when joints are swollen or red. It reduces inflammation quickly. Limit each session to 15–20 minutes and never place heat or ice directly on skin to avoid burns or frostbite. 5. Get regular checkups. Early detection is key. Many people wait until pain becomes unbearable, but by then, the damage may already be advanced. If you're over 50, make joint screenings part of your routine. Get a bone density scan once a year to monitor for osteoporosis. Request blood tests for rheumatoid markers, uric acid, and metabolic disorders. Visit a joint specialist if you have diabetes, obesity, or kidney issues. Early diagnosis plus early treatment equals better long-term joint health. Joints don't break down overnight. It's your daily habits, the little things that protect or damage them over time. Start small. Sleep a bit earlier. Take a walk each morning. Eat more greens, and you'll feel the difference within weeks. Common misconceptions and critical warnings. In reality, many people, especially those over 50, believe that joint pain is just a normal part of aging. They say things like, "It's just old age, it'll pass. No need to treat it." But that belief is both incorrect and dangerous. Yes, aging plays a role, but persistent joint pain, swelling, or stiffness should never be ignored or accepted as normal. Without intervention, the condition can seriously worsen. What happens if joint issues are left untreated? Joint deformities. As cartilage wears away, joints can become misshapen, especially in the knees, fingers, or toes. This may lead to walking difficulties, loss of function, or needing mobility aids like canes or wheelchairs. Higher fracture risk. In people with osteoporosis, even a minor fall or wrong movement in bed can cause a hip or spine fracture. Bone fractures in older adults are hard to heal and often result in long-term immobility. Sleep disturbances, stress, and mild depression. Chronic pain disrupts sleep and causes irritability and fatigue, leading to emotional stress and a lower quality of life. Beware! Common mistakes in treating joint pain. Because of fear or inconvenience, many people make harmful choices in managing joint pain. 1. Overusing pain relievers for too long. Some take anti-inflammatory drugs or painkillers daily for weeks or months, unaware that this can damage the liver, stomach, and kidneys, and even cause internal bleeding if taken improperly or without a doctor's supervision. 2. Using unverified home remedies or herbal pastes. Folk treatments passed down without proper testing may cause skin irritation, burns, or worsen joint inflammation. And treating external symptoms without addressing internal causes only delays real healing. If your joint pain lasts more than 1-2 weeks, or if there's visible swelling, increasing pain, or nighttime discomfort, make an appointment with a rheumatologist or orthopedic specialist. Early treatment is simpler and less invasive. Late treatment is often more difficult and costly. Aging is inevitable, but staying strong, mobile, and independent at 50, 60, or 70 plus is absolutely possible. And it starts with what you do today. Don't let misunderstandings keep you from living fully and pain-free. After age 50, joint health is no longer something we can take for granted. It becomes an essential part of living well and staying independent. Don't wait for pain to become unbearable. Start today with small but consistent steps. A balanced meal with leafy greens, fish, and plant-based milk. A short walk in the morning sunlight. A good night's rest at the right time. And most importantly, a mindset of care and love for your own body. If you found today's video helpful, don't forget to click like to support the channel. Subscribe to Nutigood HealthBook for more valuable health content. Tap the notification bell so you never miss a tip made just for adults over 50. Wishing you strong joints, better movement, and joyful living every single day. See you again in our next video.